In echocardiography, there are four basic views of heart: parasternal long axis, parasternal short axis view, four chamber view, subcostal view, 4C, and IVC view. For any cardiac exam, only phase ray or square probe should be used. This is also commonly called as cardiac probe. It has several advantages. First, it has excellent depth of penetration. It has a small surface area that can easily fit between the ribs, but at the same time gives you a wide enough image to cover the whole heart on one screen. The most importantly, this probe can send and receive signal rapidly in various directions, which will help with analysis of rapidly moving structures like the walls and the blood flow across the walls. Let's move on. Basic views of echo. First, we started with the plaques view. Plaques is usually the first view used at the beginning of the examination. Probe marker at 10 o'clock position. Orientation marker for this view should be facing the patient right shoulder. You see a nice image of plaques. This is the section of the heart that is seen in the view. Let's identify the structures. LA, mitral valve, LV, the aortic valve, aorta, RVOT, pericardium, descending aorta, we can see from this view. The patient is positioned in the left lateral decubitus position, laying on his left his arm tucked under his head. Place the probe in the third or fourth intercostal space at the level left sternal border. Next, we are going to move on. Parasternal short axis view. This is obtained by staying at the same place where you obtained the plaques view, but simply rotating the probe around 90 degree so that the orientation marker is facing the patient left shoulder. Here are couple of examples of short axis view. Let's move on to apical 4 chamber view. This view is obtained by placing the probe slightly below and to the left of the nipple. Sometime you will have to move the probe medially or one intercostal space up or down to find the optimal window. The probe orientation marker is held towards patient left. So, apical 4 chamber is also useful to assess longitudinal function of the heart chambers. Here is an apical 4 chamber view in an action. Apical 4 chamber is also useful to assess longitudinal function of the heart chambers. Apical 4 chamber view displays all 4 chambers of the heart, the right and left atria and ventricles. Next, move on subcostal 4 chamber view. Ultrasound probe is placed in the middle line. Let's move on next view, subcostal IVC view. What you can see in this view, I have marked here what you can see. Anteriorly RV we can see tricuspid valve, right atrium, left ventricle, left atrium, mitral valve, interventricular septum, interatrial septum.